Okay, good afternoon, everyone. My name is Pat Deeney, and I'll be your chair for this session, which is aimed at giving you some information about health action training and the courses that we're going to be running in collaboration with Nursing Now. And the way the afternoon is going to go, I'm going to do some introductions for you, and then we're going to talk a little bit about the courses, and we're also going to remind people what health action training is. I know that many of you have been to the previous webinars, but there may be some people that are coming new to this this afternoon. And we're going to invite people who actually completed our courses to comment on what the value of it was. And then we're going to have some activities and a demonstration of some applied drama. So without further ado, I'm just going to do the introductions. As I said, my name is Pat Deeney. I'm the CEO of Health Action Training, and I'm one of the trainers. Matt?
Hello, yeah. Hi, I'm Dr. Matt Jennings. I'm a lecturer in applied drama, and I'm co-founder with Pat of Health Action Training. And I come from, as I say, a drama and acting background.
Thank you, Matt. And Sue?
Hi, everyone. As Pat says, my name is Sue. I am a nurse and a lecturer in palliative care, and I am a trainer at Health Action Training.
Okay, thank you. And Sharon?
Hello, everybody. My name is Sharon Fox. I'm a qualified nurse, and I have completed the courses of Health Action Training and have done Train the Trainer.
Okay, thank you, Sharon, and we'll be hearing from you later on. So what I'm going to do now is just, I'm going to share the screen here, and okay, the first thing that we want to explain to everybody is what exactly is meant by health action training. So Matt, if you could just give us an overview of what your people need to know actually before they actually consider doing some of our training.
Yeah, so I mean, a lot of people would have already done some kind of role play for assessment or simulation. And that was where I first encountered the use of drama with nurses and other health professionals, where as an actor, I would play patients in role play for simulation. And that has a lot of benefits, but one thing we found is people find it very stressful. They find it very nerve-wracking. They don't feel prepared for performing in front of other people. And also they struggle to sort of make it relevant or particularly practical and useful to their actual clinical practice. So having come from a background as a trained actor and then working in applied drama and community drama in Northern Ireland, largely in the context of conflict transformation, I was aware of various techniques that you can use, that you get in actor training, and also various approaches that you get in applied drama, which help to build teamwork and communication skills and confidence and self-esteem and so on, to make role play simulation more effective and more directly relevant to the kinds of problems people are facing in their everyday life. So we use these simple techniques that include everything from kind of centering and grounding exercises that are similar to mindfulness in some ways, physical exercises that are similar to yoga and martial arts, some of them that help to sort of like resolve the stress cycle, to shake the stress off of whatever it is you're dealing with on a daily basis. And then we look at these particular techniques from actor training, such as actions and objectives, and how do we understand what it is that we want to happen, how we go about making it happen, how we can understand what other people want from a situation, from nonverbal communication and so on, and how, if we're dealing with a very difficult situation, we can not only suggest ways to handle that situation, but we can also try them out in the context of a role play. So we teach you acting skills in a way, in a context that is safe and supportive, to help you process and also not only suggest, but rehearse different outcomes from challenging situations. And we draw those situations from your own personal experience or situations that are relevant to that. So, and each session we do some sort of centering exercise to get ourselves present, fully sympathetically present in the moment, and then we address the kinds of issues that you're facing within your actual everyday life. So it's about teamwork, it's about person-centeredness, it's about being a centered person so that you can look after yourself, but it goes beyond self-care and personal resilience into creating a supportive environment, because we can't do self-care on our own. If you're struggling, you can't look after yourself on your own. So it's about creating a supportive network where we try practical solutions to challenging situations, and in the process, build up our confidence in our ability to handle those sorts of things. It's revolutionary and it's unique as far as we know. We've been doing a lot of research for the last 10 years and we haven't found anybody else who uses these techniques in exactly that way.
Yeah.
And the results have been
and as you say, Matt, it's the evidence-based and theoretical framework is in setting person-centeredness, the value system, and we know it works really well because we've had some very good results from that. And so what we'll do now is we'll actually, as regards questions and answers, please note there will be time allocated for questions and answers, but if you want to put a question in the chat box, you can. We have someone monitoring the questions in the chat box, and those will be dealt with at the end. So there's actually 2 courses that we're going to talk about today specifically, but in effect, in a sense, we offer also Train the Trainer. We're not really going to talk about Train the Trainer today because we want to actually emphasize the 12-hour course and the 35-hour course. And the should change for me. Yeah. The first course that we want to speak about is Coping with Crisis, Wellbeing and Growth, and Sue's going to give us an insight into that.
Thank you, Pat. Very nice, lovely to have you all join us today. I am going to give a very brief outline of our 12-hour course. Now, with each of our courses, and I'm sure Pat will be referring to that, there is a handbook which accompanies each of those courses, and it's quite an in-depth handbook with all the details and the information in there. Now, the reason for this course, Coping with Crisis, Wellbeing and Growth, I guess when we think of coping with crisis, we've only really to look at our own doorsteps at this moment and what has been happening really for the last 2 years. And who really would have thought the whole enormity of that pandemic when it first started and the impact that that is having most certainly on ourselves as healthcare professionals and of course on society alone. So we thought, let us look at developing a course to look at the well-being, the growth, look at the area of self-care and the use of the HAP methodology and how to help that, and also to help participants to, I guess, improve their communication skills and then be able to deal with these complex situations and the case within a crisis. Now, as you all know, no doubt, what often accompanies a crisis is indeed the unprecedented pressures, absolutely, and the challenges that go along with that. And there's an extreme demand on the service. And I'm sure it's the same across globally, that their services are really outstretched, along with understaffing, for example, with the pressures of that alone, staff exhaustion, the communication issues when we look at the wearing of PPE, for example, in this particular crisis. Research supports, as I'm sure you're all very familiar with, that the outlines, I guess, the psychological impact, the huge impact that a crisis can have on one's emotional responses and their own coping strategies. It's quite normal to feel frightened. It's quite normal to be anxious, to be overwhelmed, to worry about one's own safety, and most certainly associated with varying degrees of loss. And when we think of the current crisis, and I keep referring to that because this is on our doorstep at this particular time, and when we think of that, the numerous families who have experienced loss and have lost their loved ones, and coming from a palliative and end-of-life care background, it very much hits home to me the impact of those surges of deaths that we may all not have been used to, just as many, and the impact that can have, besides being distressing, of course, the burnout, compassion, fatigue, that profound emotional erosion, the depletion of being able to refuel or regenerate in order to be able to face that. So, and that's a physical, emotional, spiritual depletion. We look at this as a holistic approach. The focus of this course, 12-hour course, is most certainly that growing awareness, firstly, of the need to address the healthcare well-being of our staff, of healthcare professionals, I should say. And the whole idea, overall learning outcome, is, of course, to reframe those challenging experiences, associated with living and caring and working in a crisis situation. We help improve communication skills through using the health action training methodology, which Matt had referred to. And it is experiential learning. It is looking at the use of reflection, and that's facilitated through the use of workshops, the use of role play, discussion, simulation, and so forth. Now, the key 4 areas that we focus on is, of course, working. Now, this is very much experiential learning, the course. It is, but it refers, our learning outcomes are predetermined, so to speak, but it's a dialogical pedagogy. And what we mean by that is this is open discussion with the participants. This is very much you setting the agenda and influencing the content. So it is looking at building the confidence and the readiness in order to deal with the crisis, and really allowing us to find our voice, to be able to influence, to look at our leadership and look at our impact as a role model, as influencing. Of course, we look at the use of health action methodology, communication skills, it's core. We all are very good at our communication skills, but at times we don't get it right. We don't always get it right. The whole idea of sympathetic presence, and I know we will refer to that more when we're talking about the graduate certificate, but the idea of being present with that person, with that patient, with that family member, and you being present, being centered. The key outcome of this course is of self-care, the importance of self-care, well-being, and post-traumatic growth. Now, when we look at the assessment, it is a formative assessment. It will take place, it is ongoing. Each session that we hold, totaling up to the 12 hours, will have workshops, will have role play. And from that, then we will be given feed forward. We will be telling you, sharing with you, learning. We're all learning together in this. So it is formative. Obviously, it gives you the opportunity over the 12-hour course, gives us the opportunity to discuss and to learn from each other. Thank you, Pat. Hopefully I've kind of summed up.
Yeah, so that's good. And that course is actually accredited by the UK CPD office. Is that correct?
And is currently with the Royal College of Nursing for accreditation.
Nursing as well, yeah. So it's accreditation, it's a double accreditation there. And that's
thank you, Pat. I didn't add that in.
Okay, no, that's okay. That's okay. So, in relation to the longer course, the 35-hour course, that's the award, and that is a graduate certificate and health action training. And this course will run on 3-hour blocks as well, like just the same as the 12-hour course, but will last for about 12 weeks. And it's similar concepts in a way. It's that Matt referred to, it's about centering and person-centered practice, knowing yourself. And back to this point about this process of sympathetic presence is very important. And that can be a new concept for people because it's actually, it's not empathy per se, but about being in the moment. And that's sometimes needs to be thought about and worked through using the health action training methods. And that's quite a helpful thing. It's really about creating a person-centered and supportive culture as well. And if you remember, Matt was saying you're not just on your own, you're actually in an organization, you're in a team. So it's actually learning the skills to be able to actually, I suppose, bring people with you. And that's, in a sense, the leadership that's required, but also the organizations that you're working for influencing that as well. Because, person-centeredness is much more than actually patient-centered. It's not the same idea at all. It's person-centered is much broader. And really being able to lead and step forward and take a leadership position is quite important. And being able to actually rework through the challenging experiences and reflective processes are very important. And just like the 12-hour course, it's dialogical pedagogy as well, this idea of actually discussion, and you as a learner are able to influence what is actually tackled through each session, and it's actually becomes very relevant to you as an individual. But what happens as well is that we work in small groups, and these small groups actually work collaboratively to create a role play that's actually relevant to whatever issue they want to explore. And this is where the actor training then is really helpful then, because the actor training helps you to actually manage your objectives, make you think about your actions, and also then maybe being able to adjust to given circumstances. So that's the crux of health action training. And really sort of like helping you to manage relationships is quite important, for different groups. So why do we have preset learning outcomes? The content is actually quite experiential and exploratory, and will reflect the very unique issues that each of you will bring to the sessions. It's delivered via Zoom. The sessions will be organized in 3-hour periods via Zoom, and will involve constantly active learning. We always start with a relaxation. We finish with relaxation. We start with reflective discussions. So you're constantly practicing the health action training approach. So it becomes like a feature of your life in a way, because as we often say, we all, at the beginning of each new year, we might have aspirations to change our physical activity. And it's going one time to the gym is not enough. You need to actually be able to make it a part of your routine. And this is very, very important actually in relation to, almost like your whole professional identity begins to take a different shape. Assessment in this course is actually, you're expected as a group to present a 20-minute role play, and that will be examined by usually 2 trainers, and it'll be recorded, so you'll be able to look over it again and reflect on it and discuss it in your group. And then we have this, it's not unique to drama or the arts. It's called a viva voce, but it's actually, this method is quite unique to nursing, and we've been using it quite a lot over the past couple of years, and we find nurses find it quite exciting. I'm sure Sharon will be able to comment on that when she speaks. But this is actually like, it's like a discussion. It's like it's seeing it as an exam is probably the wrong way to present it, but it means that you're actually asked questions and you're asked to respond, and you're able to draw on your experiences from your learning in the course, but also then how the training has actually helped you in your practice as well. And just to mention, following that grad cert, which is accredited by the Royal College of Nursing and the CPD office, you're able then to actually go on and do further train the trainer courses as well, which we're not going to speak about today, but when you're on the graduate certificate, there can be discussions about that as well. So the only thing that remains is actually I think maybe at this point we'll, before we look at that slide, we might take some comments from Sharon, maybe, if that's okay, Sharon.
No problem, Pat. So first off, hello, everybody. And I'm just going to give you a quick background to myself in nursing. I'm adult trained, and I trained through the University of Ulster in Magee. And I went on then to become a Band 5 staff nurse in an accident and emergency department, and went on to become sister, then moved into primary care and was a practice nurse and a nurse practitioner. I still work in acute medicine at the moment. So that is just a brief background into my profession to date. Why did I take on health action training? At the time COVID had kind of started, I was working as a practice nurse and nurse practitioner at that stage in primary care, and health action training had a course out for teletriage. So at that stage, face-to-face had we hadn't as much face-to-face, so I thought it would be really good for me to do a bit of training in teletriage, especially around communication. But it wasn't just telecommunication that I took away from health action training. There was so much more to it. Yes, you look at communication, but it's not in the way that any training you've ever been to. First and foremost, you're the center. How are you feeling? How are you doing? How are you coping? And I don't think I've ever been to any training that has ever looked at you as a person instead of the end objective of what you can provide. So that was a very different, I suppose completely different way of training for me. And that made me sit back and kind of think, okay, hold on a minute. What is this training actually asking me to do? And really what it was asking me to do was to take a breath and say, how are you doing? How are you managing? How are you coping? And when you do that, and you become comfortable doing that, you suddenly realize that your communication is actually affected with how you are in the present moment. And with all the grounding and the breathing techniques, which I had never done before, I've never done any acting before. It was very alien to me. But health action training will do it in a very gentle, very welcoming manner that is not feeling that you are put on the spot or anything like that. It is very much teamwork, and you become very accustomed to it very quickly without realizing that you're actually doing it. So, but when you do it, it just gives you a calmness in yourself that you can realize that I'm valued in the middle of this, and because I can see the value in myself, you then start to look at how you're communicating and expressing yourselves within a team, within the patient, within yourself. And I have been guilty of times, especially in a busy A&E department, of kind of going over the patter. You're in a situation and you have certain tick boxes that you have to make sure that patients and family members and relatives understand. And you can fall into that cycle. You don't mean to, but you can. But health action training will actually take you out of that, because within the role plays, there will be challenging situations where the dynamics will change, the role play will change. So therefore your response will change. The people that's in that actual role play as a team, their views could be different to yours. And as a collectively, you will communicate with one another. How did you present yourself? How did you come across? And you suddenly begin to realize oh, well, that's not how I was wanting to portray myself. That's not what I was intending. That wasn't my objective. But because of how I communicated, that's how it was perceived. So it makes you sit back and you automatically reflect in yourself, because you have to, because then you've been faced with a situation where others are telling you, well, if you change the dynamics of how you're approaching a situation or how you're communicating, you have to reflect on how you're actually communicating as a whole. So that's what I took away from health action training, that from a communication point of view. With regards to looking at how we can be resilient, it's not resilient in the sense that we have to achieve resilience within the profession. It's not that at all. It is a way of learning to ground ourselves and put ourselves into the scenario without feeling the responsibility of having to change everything, because we can't at the current time. We can't change everything at the current time. There is so much pressure and stress, but we definitely can do our best in the current time. And what health action training will give you is the chance to breathe and say, yeah, I am doing my best. And that's all I can do. So health action training will give you so much more than communication. It will give you a sense of self-worth, really, and that you are doing good and the best that you can. So that's invaluable from, especially in the current times when it is so chaotic and so stressful and we're all under that pressure. So if you take anything away from it, it's that. But with communication skills and, there's so much training out there and everything will say, oh, you have to be an effective communicator, but nobody actually looks at how you're communicating, really. And this is what health action training will do for you. And it opens your mind in a completely different mindset, which is very, very positive, and it's very person-centered. When Pat and that has said about person-centered and patient-centered, again, it's in every bit of training and literature out there. This course will actually go to the essence of it, because it strips back all the black and white that's in every training document, and it actually goes to the roots of the emotion, the impact of the emotion, and that cannot be taught any other way than how health action training delivers it. So if you're nervous about doing any actor training, please don't be, because I am in no means an actor. Matt Jennings and the group are fantastic. They are very, very welcoming. They will ease you into it without you even knowing you're doing it. And the reality of it is, we're doing these scenarios in reality day in, day out. But through the role play and through the actor training, it highlights it. It just brings it to a front, it brings it to the front of your mind of exactly what we're doing. And Matt is so amazing at actually bringing that out of you without you realizing that it's even there yourself, certain emotions, maybe certain prejudice that you have in your own mind, or the group that potentially could have it as well, and how you react and how you feel to that and how that can affect your communication. So there's challenges in it, of course, but there's an end product with a positive result come the end of it. So I would definitely advise you to come and do your health action training, because you're going to take so much more away from it, not just for your profession, but for yourself.
Okay. So. Thank you, Sharon.
No problem.
Thank you. And I'm delighted to actually say Donna Pike has just joined us. Hi, Donna. Welcome to the webinar. Hi.
Hi. I was having a bit of trouble getting on there, but seems to be okay now.
Are you in the middle of a shift?
Yes.
We won't keep it too long.
So if you have all your patients settled and everything, Donna, I think we would welcome just a few minutes actually of comments on your experiences actually of doing a health action training course. And I think you've heard Sharon talking about it, and so the floor is yours.
So do you want to start with a bit of, your background and training in nursing and any specialisation?
Okay. Well, I work here at in a renal unit here where people have got end-stage renal failure and they're all on dialysis. And I noticed then that we had a lot of young people coming on to dialysis, and a lot of them just expressed that they felt that they just lost control of their lives coming into dialysis. Like some of them were working, had to give up their jobs because they had to attend dialysis 3 or some people 4 times a week. So I thought then that to try and get them back some control, I would teach them to do their own dialysis. So I came up with this idea, and it's called shared hemodialysis care, where patients can get involved in their own care. It doesn't matter whether they have a disability or what age they are or anything. There's no discrimination. Everybody gets offered the chance to take part in their own care. So I've got people ranging from the age of 18 right up to 90 getting involved in shared care. Some people come in, and like I have a lot of people. I had a girl who suffered real bad with anxiety, and when she was anxious, she came across as aggressive, but it's just the way she expressed herself. And so she started doing shared care, and now she comes in, she's doing everything. She gets her machine prepared and puts herself on the machine and looks after herself on dialysis and deals with any problems, and then takes herself off. And she said now that her anxiety has now changed to confidence. And the more she can do, the more confident she's getting. She said she forgets that she's got anxiety now because she's that busy working at the machine. She forgets that she's even got anxiety because, she's so busy. And then I got a really young girl then, and she was suffering just like all her friends were going out while she was coming up for dialysis. And she's the same now. She's getting so confident, and she loves doing the shared care. She can speak as an equal to me. We can talk all about, we can use dialysis jargon. And then I've got a man then who's he's been deaf his whole life, but he can't even get hearing aids. He's not suitable, the type of deafness that is, wherever it's affected in his ears. So now he is doing it, and he is amazing. Me and him, I've learned so much on the course, how to communicate with him. Whereas before,
sorry, Donna, that's what I was going to say. How did the health action training courses help?
Well, while at the start, people were saying, sure, he won't hear you. He'll not be able to do shared care because he won't be able to hear you. But I learned on the health action training, I used to emphasize what I was saying to him, or I used to speak really loud, but he didn't hear me. No matter if I shouted, he couldn't hear. And I found since I did my training that if I just speak in a normal way to him, he understands everything I say. I just speak normal. I don't raise my voice, and I always make sure that he can see my face. I don't turn around, and I don't speak over him to other people. I speak directly to him. If there's a third person there, I will, make sure he's included in the conversation. He's come on leaps and bounds, and my communication with him has really, really improved. Working with a deaf person, that has really improved. And as I say, working with other people, like elderly people, you just take everything into consideration. You just don't discriminate against people. You have to have respect for people. And then I realized that when I'm working with people too, you just have to be present with them, and you just try and block out what's going on around you. I learned all that in the course. I just focus on one patient at a time, and I give them my full attention, and I'm just present with them. And I think that the job I'm doing, it's I can really use patient-centered care because it's all about the patients. And the job that I'm doing, and I've learned on the course that it's not even patient-centered, person-centered. And I just focus on the person, and I respect everything, respect all their wishes and their choices. And we just work really well together. And I've learned so much from my patients as well. It's not just about me teaching them. I've learned a lot. We actually work in partnership. Whenever I'm trying to design like a booklet to help people, I give it to them and they give me back feedback. And then I have another patient, he actually gives me computer lessons. I teach him how to do his machine, and then he's teaching me. So it's very equal.
And this sort of equal knowledge sharing approach and learning through doing, and the teacher learns and the learner teaches. But that stuff that you got from, or at least was supported by, the health action training?
Definitely. Definitely. Since I started even communicating with people, since that when I did the health action training, my communication in here has really improved with my patients and with the staff. And things that I've learned, even like doing breathing exercises with patients when they're feeling sick or anxious. The breathing exercises that I've learned on the course has been very valuable, even for myself. When I'm feeling anxious, at my work, I will take a minute to do my breathing exercises. And I have noticed then that other staff are catching on. They hear me saying things to patients, and then I hear them saying things to their patient, about if a patient's getting anxious or they're feeling sick on the machine. I see copying what I'm doing. There's breath, and things like that. So it's good. I have been teaching staff about breathing exercises as well. So it's really catching on. All you hear now in the unit, take a deep breath, breathe with me. I'm spreading it around.
The range of breathing.
Oh, all the different
range of approaches.
Yeah.
And awareness of breath, so how you can tell from another person's breathing, how they're feeling, and even maybe what they want, so on. And how about resilience in the sense of self-care and burnout, Donna? I mean, I don't necessarily want you to get too personal, but do you feel like, this has helped you cope with these difficulties that are happening?
Mm-hmm. Definitely has. Definitely has. There, like sometimes if you're really, really busy and your workload, and then doctors are putting demands on you, want you to do this, and stuff like that. I have found myself doing breathing exercises. Might just take a minute out and just do breathing exercises and then go back out to what I've been doing. I find that it really does help me to be resilient, and I find that I'm doing things a lot calmer. I try not to panic. Even my walking, I walk a bit slower when I'm doing things. I just think,
which is one of the skills. That's part of one of the workshops.
Definitely, we learned that.
Paying more attention.
Yeah. So when I'm going to do a task that I know is going to be a bit stressful, on my way to the task, I learned on the course just about slowing down what you're doing. So I might even walk slowly and do my breathing at the same time, and then I can face the task head on. With more.
You find clarifying what you want to happen in that task, your objective, and understanding other people's objectives, has that helped?
Oh, definitely. I hope the course itself was just brilliant. Like I missed it and stopped, but I'm glad I'm doing the monthly meetings now. I look forward to them.
Good point, Donna. Yes.
Thank you, Donna, for mentioning the idea of the follow-up and support. Actually, that's a critical part of it as well. So there's like a learning community, so it hasn't just end at the, when you complete the course, you're able to.
No, it hasn't ended. No.
You can stay in contact with everyone and hop on or jump on to a monthly hot chat, we call it, hot chat.
Yes.
So that's useful as well, and that's important because it, I think most people are telling us that it is good to get an opportunity every so often to just go back and practice a few things again. And
definitely
keep it at the forefront. So that's super. I think thank you both for your comments, and no doubt everyone will be very impressed with how the courses have influenced your practice, and both of you are in leadership positions as well. So you're not just caring for one person, but you're actually caring for groups and even a big caseload, and that's quite important as well. So I think, Matt, we're ready to maybe do a few activities. I think maybe
do something.
Do something, yeah.
Are you okay? You going to stay with us there, Donna?
Yes, I am here.
Yeah.
Okay. So I was recently reading a book about burnout, and particularly about burnout amongst caregivers, healthcare professionals, but also carers within their families, by Emily and Amelia Nagoski. I don't know if you've heard of the Nagoski sisters, but they talk about the importance of completing a stress cycle. So you might not necessarily be able to control your stressors, whether or not there's enough staff, whether or not there's coronavirus breaking out in the ward, whether or not you've been paid this month or whatever they are, but you can manage your response to the stress, and particularly by completing a stress cycle. So if you get stressed out and you get a charge of adrenaline and cortisol, if you don't let your body release that, that will stay in your system and can lead to longer term health issues. So one, we want to let go of the stress that's still in our system. And two, then we want to be centered and present so we know and we're ready for what's happening right now. So just to sort of help us with that idea of releasing, we're going to be like Taylor Swift, and we're going to shake it off. So if you can stand up wherever you are, I'm going to stand up over here. If you can stand up somewhere with a bit of room to move, right? This is something you can do. This kind of shake off exercise is something you can do usually in a bathroom space if you don't want anybody to see you, or if you have an office space or whatever. And it's good to do it at the end of a shift or when you get home or somewhere you feel safe and comfortable, and just to take 10 minutes to get it out of your system. And you're just shaking, right? And you just bounce your knees and you shake your hands. Shake your hands near your head. And then we're going to do, and you're bouncing your knees. So your feet are about shoulder width apart. So you're grounded and balanced on the floor. Check your feet are as wide apart as either your hips or your shoulders, and your feet are flat, but you're bouncing on your knees. And then you're going to go shaking your right hand, and we're going to do 8 shakes of the right hand, and then we're going to do 8 on the other hand, and then 1 on each foot. And then we're going to decrease the number of shakes, change hands just to keep it going. We're going to decrease the number of shakes by 1 each time. You'll understand what I mean when I'm saying it. So we'll just go 1, 2, 3, 4, 5, 6, 7, 8. Change hands, 1, 2, 3, 4, 5, 6, 7, 8. Shake one foot, 1, 2, 3, 4, 5, 6, 7, 8. Shake the other foot, 1, 2, 3, 4, 5, 6, 7, 8. Back to the first hand, now to 7. 1, 2, 3, 4, 5, 6, 7. Change hands, 1, 2, 3, 4, 5, 6, 7. Foot, 1, 2, 3, 4, 5, 6, 7. Other foot, 1, 2, 3, 4, 5, 6, 7. Hand, 1, 2, 3, 4, 5, 6. Other hand, 1, 2, 3, 4, 5, 6. Foot, 1, 2, 3, 4, 5, 6. Other foot, 1, 2, 3, 4, 5, 6. Hand, 1, 2, 3, 4, 5. Other hand, 1, 2, 3, 4, 5. Foot, 1, 2, 3, 4, 5. Other foot, 1, 2, 3, 4, 5. Hand, 1, 2, 3, 4. Foot, other hand, 1, 2, 3, 4. Foot, 1, 2, 3, 4. Other foot, 1, 2, 3, 4. Hand, 1, 2, 3. Other hand, 1, 2, 3. Foot, 1, 2, 3. Other foot, 1, 2, 3. Hand, 1, 2. Other hand, 1, 2. Foot, 1, 2. Other foot, 1, 2. Hand, 1, foot, 1, foot, 1. Good. Then take a deep breath and shake it all out and release your voice. Oh, so as you're shaking out your body, you're letting your voice go with it, allowing yourself to free your voice from being held tight with the tensions in your body. Another big breath and shake it out. Oh, shake out everything in your body, like you're shaking it off like Taylor Swift, right? And then one last one, big deep breath. And shake it out as long and as loud as you can. And it looks a bit silly, doesn't it? Which is part of the approach we use. It's all about having a bit of fun, being a bit silly and joyful sometimes. Stretch for a big, loud yawn. Oh. Pay attention to your body. Your body knows what it wants to do in order to release its tensions. So stretch and yawn however your body wants to stretch. Oh. Try to make the yawn big and loud so you're letting your voice go. One of the most common problems with nurses and other communication and health care professionals is damage to the voice, especially on a long shift. So big, deep yawning breaths is the best voice exercise you can. It makes your breathing diaphragmatic. It energizes the intercostal rib muscles. It opens the soft palate and all the resonators in the rest of your body. So one last big, loud, stretchy yawn. Oh. Very good. Now standing, we're going to do one last exercise for centering ourselves. This is from the martial art of Aikido. So your feet are shoulder width apart. If you're not sure how wide your shoulders are, you can put your feet together, turn your toes out to the sides, and then straighten them. And they should be about shoulder width apart. Your knees are soft, and your back is long and strong. And your front is soft and open. And your hands are at your center about 2 inches below your belly button. And you breathe in as you bring your hands up slowly towards your chin. And you breathe out, you're going down to the floor, head rolling down to your chin onto your chest first. One vertebra at a time, releasing all the tension in your back as you roll to the floor. Breathe in, coming up with your arms out wide and looking up at them as they come together above your head. Breathe out, bring your hands down slowly in front of you. Look ahead of you once they go below eye level. Breathe in, hands up to the front. releasing the dove to the sky. Breathe out, hands down to the sides, letting the breath sync up with the movement. Breathe in, coming up to the sides. And then the last, release the breath and release the voice as your hands hit the bottom. So it's like this. Then sit wherever you can. Comfortably sit with your feet on the floor and your bottom on the chair. Feel your connection of your feet to the ground. Feel the connection of your bottom to the chair. Feel your back long and strong. Feel your front soft and open, open to all of the joy as well as all of the pain in the world. Feel your head floating up towards the ceiling or towards the sky. Let your shoulders drop. Bring your right shoulder up towards your right ear, slowly and smoothly. Continuing to breathe into your center of gravity 2 inches below your belly button. And then slowly over a count of 10, releasing that shoulder. 1, 2, 3, 4, 5, 6, 7, 8. Keep releasing it. 9, 10. Let's let go all the way down. And start to look at whatever you can see. And listen to whatever you can hear. And paying attention, whatever you can feel in your body. You may need to make a slight adjustment to how you're sitting to feel more comfortable. Pay attention to that and do it. And then bring your attention back to whatever you can see and whatever you can hear. So now we're centered and we're paying attention. And beyond mindfulness, like paying attention to what's happening right here now we have to clarify our intention towards somebody else. So for instance, one of the first exercises we would do would be looking at breaking bad news and subtext. So subtext is what people really telling us, what they're really doing when they might be saying something fairly simple and plain. So very often people will say, how are you? They'll ask the question, how are you? And somebody will say, I'm fine, even when they're not fine, when they're in significant pain, or maybe they just want you to leave them alone. So we will start with an exercise, how are you? I'm fine. We're exploring doing things to people, playing actions to people, while saying those words and leading into the complex situation of breaking bad news. So to start with, we'll have a simple action exercise. Look at a face on the screen. I'm sorry we can't see you, but you can see us. So look at one of the faces on the screen, and we're all going to look at each other. You look at us, we'll look at you, or we'll look at whoever we can see. And to play the action on them, we're just going to think the thought. We're not going to pull any face. So for instance, if I'm looking at Sharon, and what I first want to do is to respect her, I will just look at Sharon's picture and I will think the thought, I respect you. So we'll all try that to start with. I respect you. So we're playing the action to respect. So look at one of the faces on the screen and respect them just by thinking the thought, I respect you. And while you're watching it, you might notice how the faces change slightly in relation to that simple thought. And you might even be able to see the fact that someone is respecting another person from their non-verbal communication of their face and their body. And just to show you a slight difference, we'll now play the silent action to reject. So we're going to look at one of the faces on the screen and we're going to think the thought, I reject you. Without looking away, but looking at the face, thinking the thought, I reject you. And you may notice changes in how we look when we're thinking that thought. So that's a very simple exercise, how to do an action, as in I respect somebody or I reject somebody. You can reassure someone, soothe someone, challenge someone, warn someone, inspire someone, and you can simply practice them by just thinking with them. And you'll notice that when you see someone else doing it, you can tell, you can pretty close to tell the kind of thing that they're doing to somebody else, which makes you sort of think, okay, when I was ignoring that person talking to me yesterday, I hoped they didn't notice. But if they were paying attention, you can tell when someone's. So we bring that simple exercise into a complex situation. So I'm going to ask for voluntary here from Sharon and Donna. So a complex situation, we can take suggestions from the audience, or we could just use the usual one. One we've started a lot of our sessions with recently has been telling someone that their mother has to be isolated on a COVID ward. If somebody adds to the chat an alternative difficult conversation, like telling somebody that they have a prognosis of, you know, a limited time to live, or some other problem that you're dealing with, we can try to include that one. But otherwise, we will explore breaking the bad news of telling someone that their mother has to isolate in the COVID ward. You can't visit them. They will possibly go on Respirator, and you won't be able to see them while they're doing that. Okay. Start with "How are you? I'm fine," and we say that 3 times. And while we're thinking about it, we're thinking about what we want. So the healthcare professional wants to reassure the family member that we're doing everything we can, but also help them to understand that their mum's is very sick and they're not going to be able to see them for a while. Now, the person playing the family member wants the mother to be released from the hospital and to come home to recover with her family. If she wants to pass on with her family, perhaps. So we'll start with, we did this before, with Sharon being the family member and me being the nurse, just to show that if we can challenge nurses to go outside of their comfort zone and do a bit of acting, then we need to challenge the actors to go outside of their comfort zone and play a bit of nursing. And we'll get to a point where it might get difficult, where the communication is difficult and I might be struggling. And this is where we'll do a bit of forum theatre, which is where a person watching not only makes a suggestion of how to approach the situation differently, but then we ask them to jump in as the spectator becomes the actor, or as Augusto Boal calls it, the spectactor, and they try something different. So we're not just talking about it, we're doing it. All right, so we'll start with 3 times, "How are you? I'm fine." I'm the health professional wanting to get Sharon to accept that her mother is going to go into a COVID ward in isolation. She won't be able to see her for a while and she might be on a respirator.
You want the cameras on or off, Matt?
Well, that's right. That's a very good point, Sharon. When we've been doing this as telephone triage, we've had cameras off. So we're focusing entirely on the verbal communication as against the non-verbal communication we can get from seeing faces. I would say at this point, we'll go for cameras on so we can see each other. But if everybody else turns the cameras off, and then at some point I might stop when I think that you've gotten to a very difficult situation and invite somebody else to join in. Okay, so if you can turn yours off. Okay, thank you. So, how are you?
I'm fine.
How are you?
I'm fine. I'm not fine.
You're not fine.
No. No.
Are you worried about your mum?
Yeah, I'm really, really worried about Mum. I don't know what's happening. I just want her home.
Has anyone else spoken to you about what we're planning to do with Mum next?
No, not really.
Okay.
I don't know what's happening.
Right. Are you comfortable enough talking here, or?
Yeah, I'd really appreciate if somebody could tell me what's happening.
So we've been doing the tests on your mum, and it looks like we're going to have to take her into the COVID ward because of her shortness of breath. She's struggling to breathe. So we think
She
that
got COVID?
she has COVID, and it seems pretty advanced. It's inhibiting her. She's struggling to breathe, and we're worried that this could start presenting a strain on her heart. So we're going to put her onto a COVID ward And
I don't want her to go to the COVID ward. I really don't want her to go to the COVID ward. She's so elderly. Could I take her home? Could I look after her at home? I don't care if I get COVID. I don't want her in the COVID ward.
I understand, Sharon, you want to spend this time with your mother and you feel like she would be better off close to her family. And we get that. There's a lot of people feeling that way these days. But the thing is, it's not so much about whether or not you might catch it or any other members of your family might catch it, which is a risk, and other members of the community. But it's about what's best for your mum right now. Like, she is struggling to breathe, and we feel that we need to put her on a respirator in order to help her to breathe, to help her to get through this stage of the virus so that she would have the best chance of recovery.
What do you mean a respirator? What does that mean?
Respirator. So it's a machine that will help her to breathe through a tube that will go down her throat.
Does my mum know this is happening?
We have explained to your mother that this is the situation, and you can come and see her through the window before we take her to the COVID ward, but it will be to
Through a window?
So yeah, you won't be able to go into the room because of the infection that there is in the room, but you can see her to say goodbye before she goes up to the ward.
Say goodbye? Like, what do you mean goodbye? Like, you know, at the end of the day, it's my mother, and I know you are doing everything you can medically, but this is my mother. She's raised me. And the only way I'm going to be able to see her or be in any way with her is through a window. And she's obviously really sick if you're taking her and putting her on a ventilator. So
yes, I'm afraid there is a chance that she may not make it after the ward. So
I want to bring her home.
Goodbye for now, and we will do everything we can to sort of help her, and we're very confident that we can help her recover. But once you're on the COVID ward, there is a chance that it might be difficult.
I want to bring her home.
I understand. So we'd stop there, and we see that there's a fairly challenging difference in objectives. Sharon wants to take her mother home. We want to keep her in the hospital. So Donna, could I ask you to turn your camera on? Donna? Hi, Donna. Would you have approached that conversation differently from me?
Well, maybe slightly, just maybe what, we could have explained a lot more. We could explain more about her condition.
Excellent suggestion, Donna. Excellent suggestion. So, Donna, as you know, with no further ado, we'll jump straight in. And if you're wondering, this Donna will be performing with the experience of having done a course, but also she was as amazing as she's going to be just now. The very first time we encouraged her to join in on a situation. So, Donna, I'm off. In fact, if you want, we can do it as the impro tag. I'll introduce you to Sharon. Would you prefer it that way? I'll introduce you to Sharon as my colleague. Or would you start the conversation from the beginning without me?
No, that's okay. You can introduce me.
Okay, so we'll continue on. So hello, Sharon. This is my colleague, Donna. She is more of a specialist in COVID ward treatment and the isolation of patients there. So hopefully she will be able to provide you with some more information that will be more reassuring to you as we look at your mum over the next couple of days. Is that okay?
Okay.
Right. Thanks, Donna. Thanks, Sharon.
Thank you.
Just be in touch. Let me know if you need anything else.
Oh, hi, Sharon.
Hello, Donna.
Sharon must be very worried about your mother.
I'm petrified, Donna. I'm absolutely petrified.
That is understandable. COVID has just been a terrible situation for a lot of people. I'm seeing it day in and day out. All I can tell you about your mother, when she came in, I know you probably thought she had like a chest infection or whatever, but we've been checking her bloods and her observations, and they're not getting any better. They're actually deteriorating daily. like her infection markers and that are up, and her chest. When we did an X-ray on her chest, we could see that her chest wasn't great, And I know you'd love to have your mother home.
Oh, do you know what it is, Donna? Since she's gone on, I haven't been allowed in. Every time I ring, they're telling me very, very little on the phone. And now Matt, the other nurse, has told me that my mum's going to be put on a ventilator. I can't even talk to her. I can't be with her. And I know yous are doing everything yous can from a nursing and doctor point of view, but I don't want her to be on her own.
Could I pause you there for a second? Beautiful work, Donna and Sharon. Thank you. So just to get some of the participants involved, could you suggest an action that Donna could play? Now, it's a simple thing. It's a one-word verb that you think Donna could try. She maybe has done reassure, understand, validate, inform. What's something else Donna could do, one word as a verb, to help Sharon to accept the advice, or to come up with a shared decision that is not necessarily following exclusively Donna's advice. So it could be a process of shared decision making. So anybody can just stick into the chat box a verb. Take a breath. Okay, cool. So taking a breath is a very important thing. We always need to do that. But what do you want her to do to Sharon? So you can't breathe, Sharon. So touch, excellent. Touch, very difficult these days on Zoom, but a very important point to be making, that therapeutic touch. Is there something we could do while we're on Zoom or not able to physically touch somebody that's similar to touch? Can we, or do you want to try touching metaphorically, Donna? You want to sort of try touching her with your voice and your body language, even if you can't touch her physically? Is that something you think? Empathize. Now, empathize, that's a very good question to be sort of raising there, Hazel. So we work with sympathetic presence, which, according to the person-centered nursing framework, is an alternative to empathy. So empathy in nursing, sometimes it's not possible to empathize fully, nor even desirable. If Sharon had a broken leg, she wouldn't want Donna to feel the same pain as her, and Donna couldn't feel the same pain as Sharon does in her broken leg. So in that simple sense of empathizing, as in I can feel your pain, I know what it's like in your shoes, we have the alternative of sympathetic presence, where we're fully present to how we're feeling and how the other person's feeling, but aware of the difference. So it's assure her. We'll try that. We'll have an assure her from Huda. Donna, you want to assure her that everything's going to be all right, and in the process demonstrating sympathetic presence, that is paying attention how she feels and the difference there between how she feels and how you feel, and also maybe even metaphorically wanting to touch her therapeutically if you could. Can we try it with that? Touch and assure.
Sharon, I know you're really worried that you don't want your mum being on her own because she's used to being at home. But I can assure you, she's never on her own. See, when we take her in the ICU, she's always going to have one-to-one nursing. She'll have at least one nurse with her at all times. What I could do, Sharon, you could FaceTime your mum, and we could put the camera on, and you could see her. You could see her face at least, and you can say things, because maybe your mum might not be able to speak to you, but she might still be able to hear you. So you could talk to your mum, and then maybe when she hears your voice, they always say it's good if someone can hear, their family member's voice. So you could talk to her and you could see her all the time, and she'll never be on her own, because like either myself or someone else will always be with her. So never worry about her being left lying on her own. That won't happen.
I would really, really appreciate if I could talk to Mum, if she could at least hear my voice, that she would know that I'm there in some way.
Yeah.
I know you are doing everything you can, and you are caring for Mum as best you can. It's just, I just want my mum. I want to be with my mum.
Thanks, Donna and Sharon, just to stop you there. So how did it feel when Donna was using those slightly different actions, Sharon, assuring you, almost physically touching? Did it feel like you were being touched or assured?
The end result obviously wasn't what my intention was, But Donna reassured me to know that my mum was being treated as a person, not just a statistic and COVID. And that despite Donna not knowing my mum, she will treat her as a person on a level that she will try and accommodate the family in some form of keeping in touch. And that's where the reassurance comes through.
And just to notice a few things about the way Donna did it, she actually stated her action. She said, I can assure you.
Yeah.
She also said things that she hadn't said earlier, neither had I, about how you can FaceTime and the importance of having a nurse will be with her one-on-one at all times. Those things might not have occurred to you, Donna, to say to Sharon until you were focusing on reassuring her and even sort of metaphorically touching her. So you can see what happens here is once we try these ideas and we explore what happens when we use them, things come up that we wouldn't otherwise think of. Yeah. Once we're engaging our imagination in action, then we discover things and abilities and ideas that we would have that we would never think of if we were just sitting around talking about it. Right. So this is how it works in terms of exploring other people's suggestions. They don't just make a verbal suggestion, they come in and try it. This idea of actions, what are you doing to the other person? What do you want? Do they want? How do you deal with the conflict in those objectives? And always starting from a point of being centered in your breathing and in yourself so that you can become more sympathetic, present to the people you're working with, whether it's patients, family members, or colleagues and team members. Simple demonstration of, and I want to thank Sharon and Donna. It's pretty gutsy to get up in front of a crowd of dozens of people from all over the world. And there you go. I mean, Sharon, Donna, I don't know if you want to say anything. You were not that confident in performing at all, let alone in front of people when we first met, were you?
No.
No, we're all shy.
Definitely not. But I think what the actor training does, and you don't realize it, is it's so relatable to nursing and the profession, purely because of the emotion that comes along with it. It's really firstly identifying the emotion and recognizing it for what it is, and then once you do that, you kind of gain a better understanding about the emotion and the effects of it. And even that simple scenario, like when I was dealing with you, Matt, I was trying my best to avoid you, no matter what you were saying. I didn't want to look at you, so because I didn't want to hear you. And where the difference was with the change and, you know, trying to assure, I felt that Donna, even though my objective was to take my mum home, it really wasn't my objective. My objective was, I just want my mum looked after. I want her to know she's safe. I want her to know she's loved. So it's recognizing the emotions and the end result of what comes along with it. So from an actor point of view, health action training kind of glides you into that without you actually realizing, until you're kind of maybe halfway through and you're thinking, oh my God, I'm actually acting. Well, but you're not really, because you do this day in, day out, but you're understanding it on a completely different level and respecting it on a different level.
It starts by looking at what you already do. And as Sue was saying, 99% of the time, 99.9% of nurses are absolutely brilliant in communication. So we start with situations that are a bit more easy to deal with than, say, difficult breaking bad news. So we start with a situation where you have had what you would see as a successful communication at some point today or recently in your professional life. So we start by looking at what is it we're doing when things go right, and then how can we take some of the skills and the confidence we have from identifying what we're doing when things go right to bring them into play consciously when things are more challenging. So we're always looking at what you already do. And it's just a way to frame how you think about it and to rehearse and practice different approaches to it. And as you say, emotional states are in there, but we see how emotional states are so completely tied up with an understanding of what one's objective is. So for instance, if we have a patient or a family member who's really, really angry and demanding aggressively that they want their mother to be released from the hospital, if we understand that as what is their actual objective, what is it they really want that they're not getting? And as you said, you discovered, we can talk about it forever and not discover it, but we discovered while we were putting it into action and playing with it as a role, that actually your objective that was making you so upset was you were wanting to make sure that your mother was okay. So when Donna was reassuring you she was going to get one-on-one care and you could FaceTime her at any time, you communicate with her directly, that was helping you to discover that in that moment for that person. And I have to say, not only were Sharon and Donna pretty sort of reluctant when we first asked them to engage in any drama activity, but it didn't last very long. And as soon as they started to sort of, get this idea of I'm going to focus on what I want and how that relates to the other person, as you saw, they have to be asked to stop because they can continue to improvise all day long, as they do every single day of their working lives, because we are all always already acting and performing our professional roles. So why not learn some basic performance skills to be more conscious and effective in how we perform those roles? That's
Okay,
how
thank you.
giving away all the secrets.
Thank you. Just before we go into just a slide of when we might be offering the courses and the question and answers, but we have about 15 minutes left, so we want to really give some time to question and answers. If you can put in any questions about the courses you have, and you'll see as well that you can now register for the courses there. There should be a link for you. Just before we leave the demonstration, Matt and Sharon and Donna, someone brought up the point about tone.
Yes, I saw that.
Yeah, and that's quite an important thing, because we as nurses sometimes we talk a lot about, oh, make sure you have the correct tone, but what health action training brings you is actually playing the action to help you. The tone, it's just a different focus, isn't it, man?
Yes, I mean, so a lot of people we would have worked with have been taught, one, maintain eye contact, two, use the person's name as often as you can, three, remember some fact about them that is personal so that they can feel like that you're remembering them as a person, and four, speak with the appropriate tone. But the tone that is appropriate is one to do with the intention behind it. So for instance, I could do all of those things, maintaining eye contact while looking at Sharon and trying to use a soft voice, Sharon, to remember one thing about Sharon, such as that Sharon wants her mother to come home, Sharon. And yes, as you're pulling your face, because what starts to happen is I'm actually being condescending or false, right? So I could still be talking quietly and I could still be using her name and I could still be remembering something about it, but we think of it as a formula, and there isn't a formula for appropriate communication. The trick is to be in the moment with the person, clear idea of what you want, clear idea of how you might want to get that. So if I want Sharon to feel comfortable, if I want my tone to be reassuring, it's not about, what I do with my voice. It's about so my intention, as we were given by the people who suggested it, to reassure her. In which case I might not even necessarily say anything to begin with. I just look at Sharon and think, right, I want to reassure you. Hi, Sharon, how are you? So you're feeling like you understand what's going to happen with your mum now?
Yeah, I understand it a bit better.
Now, hopefully that tone was right, but I'm not thinking about the sound of my voice. I'm thinking about how I want to affect her. Yeah. So that's the thing. So it
almost like happens, it awakens a natural kind of process, and it just means that the two bits are connected.
The difficulty with focusing on tone or other kinds of tricks is that then I'd be focusing on me.
That's it.
I make my voice sound, right? Or am I using her name often enough? Whereas the trick with the active training techniques we use is focusing on the other person, so I become less self-conscious. and less concerned with how I'm presenting myself and more concerned with how the other person.
Yeah. I think what we emphasize as well, that people get very hung up on the idea of what words they'll use, what do I say? But this shift towards focusing on paying attention, actions is just liberating. I think it's a liberating thing. And what happens is that you begin to flourish in no time at all, and you get a feel for the sense that you're becoming more person-centered in your interaction, not just with your clients and your patients, your families, but also your colleagues as well. And as Donna emphasized there, you become a role model quite quickly. So I wanted to thank you all for paying attention to that, and the comments that were put in the chat box. There's an opportunity for you now to ask any questions, but just before you do that, I was just going to share a screen with you, which actually, this is mere suggestions. The two courses are almost like being run almost simultaneously, but our teaching days are Mondays and Thursdays, and the 12-hour course will be offered on a Monday, and we're starting on the 21st of February, 2022, and the 12-hour course will last for 4 weeks. Yeah, we'll also start a second cohort on the Thursday, and that'll last for 4 weeks, and then we'll also then a little bit later, just a week or so later, we'll start the graduate certificate, which is the longer one, the 35-hour course, and we'll also commence that on the Thursday as well. So Mondays and Thursdays are our days, and then you can see that we're trying to be as flexible as possible in relation to meeting needs across the globe, and so we're recommending these times. We hopefully, but the important thing is if you register for the course and communicate, via the Nursing Now link as to what times would suit you and what course suits. This webinar has been recorded, so you can play it back, or if you have any questions, you can email them to myself or to Nursing Now, and we'll dialogue with you and try and get you the course that suits you best. Okay.
Yeah. As Pat's pointing out, I was just going to say they're the currently scheduled dates, but we will be running 6 of the short courses, the 12-hour courses over the year, and 3 of the graduate certificate courses, or possibly more if there's demand. So if those dates or time slots, notice that they're all in GMT, and I think Greenwich Mean Time is a bit outmoded. We're supposed to call it something else. I've forgotten what it is now. But that all those times, if they don't suit you, if you could contact Nursing Now and say what dates and times would be better suited to you. We're looking at time slots from 9 to 12, 1 to 4, or 6 to 9. GMT to start with, but if there's enough demand from enough people in a particular time zone, we can schedule other sessions on other days.
Okay, so a few minutes left. If there's any, you can put a question into the Q&A box if that's if you have a question.
And by the way, of course, this is running over a 3-year period. So in this first year, we'll be running 3 of those graduate certificates, 6 of those short courses, and a trainer's course. So the other 2 courses where you can do them after a graduate certificate to become a health action trainer in your own country, because this is built on the principle of each one, teach one, as you can see from Donna, using the techniques to teach things for other colleagues and for patients and family members. So over the next 3 years, each year we'll be offering 6 of the 12-hour Coping with Crisis courses, 3 of the graduate certificates, and a trainer's course once each of the next 3 years. So contact Nursing Now through those forms to register an interest, and it's all free, available to you thanks to the funding of the Burdett Trust. So we're very, very grateful to Burdett Trust and Nursing Now for making this possible, that we'll be able to share these things that we found helpful for nurses in Northern Ireland with you wherever you are. Questions in the questions and answer box, and we'll do our best to answer them.
Okay. Adelaida is thanking us for.
Thank you, Adelaida. And I think it's Hannah or Andrea have put also, if you have any questions, if there are no questions occurring to you right now, but they might come up afterwards, to email that address, info@nursingnow.global, and we'll do our best to provide written answers to any queries you have. Just to let you know, we have been doing evaluation of the courses. We've run 6, I think, is it 5 or 6 graduate certificate courses over the last year, and also one of the trainers courses and a bunch of shorter courses. And in each case, we've evaluated them in relation to resilience with the Connor Davidson Resilience Index, a psychological questionnaire tool, as well as person-centeredness from the Person-Centered Practice Index. And in all of our courses so far, there has been a significant improvement of 10 to 25% in both resilience and person-centeredness on average, and particularly in areas such as leadership, managing difficult situations, managing unfamiliar situations, working within teams and so on. Very, very high scores. Very gratifying to see that these sort of objective questionnaire scales have showed significant improvements in person-centeredness and resilience for the nurses we've worked with and their teams. And that's, I think it's just over 100. Thank you very much from Milagros Abrania. I'm not seeing any questions in the question box. Oh, wait on. Tulipoka Soko. Sorry if I'm mispronouncing your name, Tulipoka. I've just retired from practice. Can one still register for the course? That's a good question. We have been working with retired or semi-retired nurses who have gone back to working in telephone triage, one to keep their hand in to help out when the nursing sector is so heavily understaffed as it is at the moment, with everyone, up to 40% of staff in some workplaces being off with COVID or having to self-isolate after working with someone who has a positive test. So if you are a retired nurse but who is still active in some level of community or voluntary nursing, absolutely feel you're welcome to join us, especially if you're sort of maybe mentoring other younger nurses. One of the best things about it is because we're drawing on your experience and your knowledge. So you might know a way to approach a difficult conversation or a difficult situation. Your experience and your ideas from that are, we're all learning from each other. So it's very valuable to have nurses with a lot of experience to share with younger nurses. The fruit of the knowledge.
Just to add as well, we say nurses, we mean midwives as well.
Sorry, yes.
Any field of nursing, mental health, learning disability, community, acute care. Really, it's a broad field of the nursing profession across the world. So
yes, we have already worked with groups that have included midwives and mental health nurses. Yeah. One of the good things has been when we've been able to combine those kind of disciplinary backgrounds, because some people might think mental health nursing is different from adult nursing, or midwifery is different from nursing. When you start, or management, we've had people from management levels, particularly in sort of leadership roles. And one of the things you find about once you start working together on these things is not only how much we have in common, but also how much we have to learn from each other. So all people from all walks of disciplines, all levels.
We've actually got, I think there's some questions in here now.
Can I just add, sorry, Pat, can I add to that, the lady who is retired and potentially taking part in the course? I think it's important just to highlight that this course, the impact on both a professional aspect and your applicability to your practice, but also on a personal level, and the learning that can take place and build confidence and so forth, even on that personal basis.
Yes, we've had the nurses who said it's not only helped with the parents and the patients, or the parents and the family of the patients they're dealing with, but also with parenting and their own children. When they're using this sort of approach to sort of work out what it is that the 3-year-old really wants when they're having a tantrum, or to teach them a breathing exercise to calm down.
Okay.
And
I think,
Hazel Tan says, I think this kind of training can be helpful for professors who are conducting clinical experiences with students in a virtual classroom. That's a very good point, Hazel Tan. In fact, that is how we started out back in 2013, myself and Pat. Pat Deeney was taking people through the simulation role plays that nursing students needed to do to pass their exams in order to go on to become registered nurses in the UK. And initially, he invited me to just help those nursing students do a better job of passing those simulation exams. In the UK, for instance, international nurses have to pass what's called an OSCE, an Objective Structured Clinical Exam, which involves role play. So in fact, we started out developing these techniques as just a short 1 hour workshop for nursing students about to do a role play, simple things that could help them to get more out of that, make it more valuable and less terrifying for them, because often people find it very challenging to perform in front of people watching. So yes, this is very useful for people who are working in training and assessment using virtual classrooms and clinical experiences. That's how it started.
yeah, there's a question there from Mark Beasley. Mark, you're wondering, can you do both, just within the spring semester, as we're calling it? I think it would be important actually that you realize it is possible to do both, but one, there's slight overlap in relation to concepts, so it might be more advisable if you did the graduate certificate. It would actually be as a package for you. I think that would actually be better.
But also, he brings up a very important point, Pat, doesn't he, that you can do the 12-hour course, and if you think that you would like to learn more, then you can then go on to do a graduate certificate afterwards.
That's correct, yeah.
And if we have a significant number of people who've done a 12-hour course and then want to go on to complete the graduate certificate, we can either enter you into another extra graduate certificate, or we could have a 24-hour short version, because you will have done the basics in the first 12 hours of the short course. So if we got, say, 20 people who had done the short course and wanted to do the grad cert, we could then put on a special session for an extra 24 hours, or just go into the next. I wouldn't do them at the same time, like as you say, overlapping. But I would do, if you're not entirely sure, I would say do a short course first, and then join a graduate certificate. Or as Pat says, just go straight into the graduate certificate. The main difference with graduate certificate is you learn more techniques and you get to explore more particular situations from your everyday life. So, obviously with a 12-hour course, we don't have as much time to explore things and to learn as many different techniques. I also see the question from Joe Prithert, can we use with AHPs, allied health professionals? Yes. In fact, Joe, these same workshop techniques I have used with people from all sorts of different professional walks of life, including security forces, police officers, ambulance, brigade people, also children, young people, carers for people with learning disabilities, older people, carers for people with older people. I mean, basically, the drama techniques are transferable to any situation that anyone is dealing with in their daily lives, personal or professional. So whatever group of people we're working with, you say, these are the kinds of situations I'm encountering, these are the kind of challenges I'm facing. We give you over the 12-hour course basic introduction to basic techniques and principles, over the 34-hour course more detailed work on the acting principles, and then we explore whatever situations are emerging for whatever people's professional role is.
Okay. And could I just say to everyone, if you play back the recording, you have more questions, please come back via Nursing Now or email us directly if you wish. It is important.
Sorry, Pat, to interrupt. I just noticed one question there from Huda. There's conflicts with my time as I'm working 12 hours duty. Can I choose a time or is it fixed? So this is where we want to say to you, if there's currently allocated slots don't suit, let Nursing Now know, and let Nursing Now preferred time preferably in GMT, so we just know where we're coming. But if you just give your local time, tell us what time zone you're in, and we can work it out from there. But what your preferred time slots and days would be, apart from Tuesdays and Fridays. So we can't do Tuesdays and Fridays at the moment, but any Monday, Wednesday, or Thursday time slot of 3 hours, just 3 hours a week, whichever suits you best. And if you could also indicate in that whether you want to do the 12-hour course, 35-hour course, and then when we see what responses we're getting, we can schedule subsequent courses to meet the needs of the majority. So at the moment, those times are fixed, but we will schedule the next ones on the basis of what suits you best.
Yeah. Okay, so that takes us to the end of the webinar. I hope you all enjoyed this afternoon, and could I thank the team for their input, and thank you for your input in relation to questions and comments. And we'll still have to say goodbye. Okay.
Sharon just has a.
Oh, Sharon, you wanted to comment?
Sorry, it's just on the chat. Susanna has put on something there as well. Susanna Zafra, just in case it was missed.
Yeah. So this is over the next 3 years. Over the next 3 years. So between now and January 2023, we're going to be running 3 of the graduate certificates, 6 of the short courses, and 1 of the trainers programs. And then from January 2023 to January 2024, the same again. And then from January 2024 to January 2025. So over the next 3 years, these will be available. And we will also be scheduling them after this first set, however it suits the majority of people who are applying to join. So over the next 3 years, whatever you need, we will provide for free to you and your colleagues in your home country.
The time is now. The time is now.
Yeah.
First in, first served. Yeah.
Yeah, that's it. Okay. Thank you very much.
Bye.
Bye.
Goodbye. Bye.
Bye. Bye. Bye.
Bye-bye.